Hello everyone, this is my classmate Justin and I'm Lady, and today we're going to be presenting the Time Up and Go test, and it's also called TUG.
So the TUG is a short test that's used to measure the client's functional mobility corresponding to things like their balance, their gait speed, and functional capacity. It's also been used as a measurement to predict falling risk among the elderly community. So a few things to know is that it's a bottom assessment. There's no cost to access to this measurement. It can take anywhere between 2 to 5 minutes to complete it, and it's generally administered through paper and pencil. And the population, like we said earlier, is suited for the elderly community, so 65 years and older. So some of the diagnoses that you may see when doing this test is things like arthritis, joint conditions, post-surgical hip fractures, CP, multiple sclerosis, Parkinson's disease, and just a couple other things. One of the things to know about the test is that if the client doesn't present any cognitive or physical deficits, the test can take a few seconds.
The materials that you're going to need to do the test will be an armchair, in a standard armchair, and it should be 46 centimeters high from the floor to the chair. You're going to need a stopwatch. It can be your phone or a timer, and then you're going to need a tape where you are going to measure those 3 meters for the client to be able to know when do they need to turn. You can even use a cone or any type of material that you can place it on the floor to let the client know when measuring the 3 meters. Before the test, you are going to make sure that the chair is stable to prevent any movement when the client stands and sits down in the chair. And then you are going to have all the materials ready, and you're already going to mark the 3 meters line on the floor, like I said before, by using a tape. And then you're going to have the client performing the test once without timing them. Okay, and it's time to practice. Okay.
All right, so I'm going to be the occupational therapist, and the lady is going to be our client. Hi there, so my name is Justin. I'm going to be your occupational therapist this evening. So we're just going to do a quick assessment to test a few things. So is that okay with you?
Yes.
Okay, so what we're going to do is I'm going to say ready, set, and go. And on go, I want you to get up and walk 3 meters forward towards the line we marked right here. And you're going to turn around and then sit back down. Okay? All right, so ready, set, go. All right, so we're going to do it one more time, but this time I'm going to time you, okay?
Okay.
All right, ready, set, go. Perfect. So a few of the things that you might want to note when doing this test as the OT, you definitely want to try and pay attention to the things like the client's posture and the base of support during the test. So for that test, lady's time came out to 8 seconds, and now we're going to explain the scoring.
So the scoring for the test, as Justin said, if the client performs less than 10 seconds, that will indicate normal. More than 20 seconds will indicate that the client cannot go outside and is movable without a gait aid. And if the client takes 30 seconds or more, it will indicate some problems, and it will mean that the client cannot go alone and it requires a gait aid. If a score is higher than 14 seconds, it will indicate a high risk for falling. That's it. Thank you.
All right, thank you.